This spotlight on employee benefits is sponsored by Colonial Life, helping you help your business. For more information, please visit coloniallife.com. Nearly 59 million Americans went without health coverage at some point in 2010, according to a Centers for Disease Control and Prevention report. CDC officials said the number of those without health coverage in the beginning of 2010 increased by 4 million from the same time in 2008. In addition, the report said that 9% of adults lost insurance coverage this year, but public insurance plans only accepted 5% of those individuals. The CDC reports 22% of adults between ages 18 and 64 are uninsured. The number of people lacking insurance for a year or more is also increasing from 27.5 million in 2008 to 30.4 million in the beginning of 2010. Dr. Thomas Frieden, director of the CDC, says the data in the report allows them to debunk two myths about health insurance. Quote, "The first myth is that it's only the poor who are uninsured. In fact, half of the uninsured are over the poverty level, and 1 in 3 adults under 65 in the middle income range, defined arbitrarily here between $44,000 and $65,000 a year for a family of 4, were uninsured at some point in the year," unquote. The second myth, he says, is the argument that only healthy people risk going without health coverage. Frieden says that 2 out of 5 people who were uninsured in the last year had 1 or more chronic diseases. More Americans are opting for health insurance plans with high deductibles and low premiums, leading health experts to assume many are skipping routine preventative care. The number of employees with individual deductibles of $1,000 or more tripled in the past 4 years to approximately 20 million this year. Some Americans have deductibles of up to $10,000. Not all of these individuals are choosing the high deductible policies. Some are forced into the policies when their employer decides to offer only high deductible policies with lower premiums to cut costs. Experts believe that many with high deductible policies forego expensive routine tests such as colonoscopies, since they would have to pay for them out of pocket. They say the consequences of this trend are serious. A UCLA Center for Health Policy Research study found that of the 3 million Californians with high deductible policies, 504,000 put off seeing health care providers and cited costs as the primary reason. Experts warn this contributes to high medical costs, since these people are more likely to develop serious, expensive health problems that could land them in the emergency room or hospital. However, as health care reform takes effect, this may be offset. As of September, new policies are required to pay for several types of preventative care. Additionally, in 2014, individual deductibles for small business employees will be limited to $2,000. Few Americans are enrolling in high-risk insurance pools, contrary to predictions made by the government's healthcare actuary. Under healthcare reform, hundreds of thousands of people with pre-existing conditions who would otherwise not be able to obtain coverage are now able to enroll in these high-risk pools. In most states, plans began operations 2 or 3 months ago, yet the Department of Health and Human Services reports only 8,011 people are enrolled. The government's healthcare actuary predicted that hundreds of thousands of consumers would rush to enroll in the plans, and the money allocated to the plans would be depleted by 2012. Instead, 21 states have fewer than 50 people enrolled. Administrators of these pre-existing condition insurance plans say low enrollment could be due to lack of consumer awareness, the requirement that applicants be uninsured for at least 6 months, and premiums that are deemed too expensive by potential enrollees. The HHS says that in January it plans to increase enrollment by offering consumers more plan choices with different deductibles and premium costs. For more industry spotlights, visit producersweb.com.